Bismillahirrahmanirrahim. I start the CMA with the name of Allah, who is very, very helpful, kind, and merciful. CME update by Mother and Child Survival Group of Pakistan, CME, by Dr. Tariq, Obsgyne Family Emergency Specialist, Turnist Gulf KSA, presently a district gynecologist. Topic for review today is a very, very important topic. A couples living together after 2 years are not having a baby, an infertile couple with Oopsie came to you for advice. A brief review of evaluation and assessment. They need to be evaluated with full detailed history of frequency of the coitus, sexual, statistical, drug, and gynecological history. Also having a lifestyle, smoking, alcohol, and use of recreational drugs. Their BMI and weight and height and BMI also to be checked. And then general examination and the pelvic examination, they look for discharges, any fibroids and pelvic masses. They should be reassured that if there is no any unidentifiable cause of infertility, 90 to 90%, 5% of the couples, they can be successful in having a pregnancy. They should be explained and they should all be given options and make an informed decision. For male, semen analysis is important, and for female, the test of ovulation and tubal patency remains most important thing. And also chlamydial infection and bacterial vaginosis should be sought out and treated because they lead to pelvic infection and related infertility. For ovulation, the tests are serum progesterone, day 21 serum progesterone, or mid-luteal serum progesterone, and follicular study by TVS, transvaginal ultrasound. After that, if there is no identifiable cause is there, pelvic HSG, stereosulfingography, remains the investigation of choice, and it gives you the idea of tubal patency and not of occlusion. If there is any needs any identification of problem, laparoscopic confirmation is mandatory. It's also a gold standard for the tubal patency and can be see other pathologies as well, like endometriosis, adhesions, and pelvic masses, and nodules in the pouch of Douglas. So the patient after HSG diagnostic laparoscopy is important, and also we have to see that management is brief. Management is a healthy lifestyle, a good diet and exercise, and reduction of the BMI high, and decrease in the intake of alcohol and both for both male and female, and also the use of recreational drugs important, and smoking. They should avoid both regular and passive smoking, and also they should be given sessions for cessation of smoking. The recreational drugs and marijuana cause decreased sperm count, and for the female also it is very important to, if needed, to assess for the rubella status and rubella vaccine, and pregnancy should be avoided in the first month of the vaccination, and if relevant, cervical screening should be done. Then if all these couples should be referred for specialist center for evaluation and assessment, and they should be given leaflets and support counselors, and should be counsels. Then, as I have told you that mostly there is identifiable cause or unidentifiable causes. The causes are 39%, these causes are unidentified, and the investigation, all couples having 2 years not having baby or infertile should have to be investigated, and they can be investigated earlier if the age is 35 and there is any identifiable problem is there. The other factors are ovulatory problems and tubal factor, male factor, and male and female factors. The ovulatory problems are 27%, tubal factor are 14, and male factor 19, and the male and female factors are 30%, 39%. The hysterosonography is the test of the choice, as it confirms the tubal patency, and then the infections like gonorrhea and chlamydia should be checked in for both, and if found, PCR is the test, and if found, it should be treated. Contact tracing, identification, and notification, and referral to a gum clinic. So we have also to sort out about the other drugs, and the important drugs are which have an effect on this libido and sperm count. They should be sorted out, like sulfur drugs, they decrease the sperm count, like narcotics, they decrease the libido, and phenytoin with ejaculation difficulties, and this diethylestylbestrol with testicular atrophy, and this radiotherapy with germ cell depletion. So patients needs to be reevaluated and confirmed. We must not forget our thank you for the patients listening, and we will be takeaway is pray, praise, trust, love, follow Allah, and follow Suesnas Sallallahu Alaihi Wasallam, our health and survivor, and we must not forget our glorious past, and La ilaha illallah Muhammad Rasulullah. Allahumma salli ala Muhammad wa ala Muhammad kama sallaita ala Ibrahim wa ala Ibrahim innaka Hamidun Majid. Allahumma barik ala Muhammad wa ala Muhammad kama barakta ala Ibrahim wa ala Ibrahim innaka Hamidun Majid. وكفى بالله وكيلا وكفى بالله نصيرا, and Allahumma ajirna min an-nar, save us from the fire of Jahannam. Our glorious past, दुनिया में इनकी ठोकर से सहरा दरिया सिमट कर पहाड़ इनकी हैबत से राय. Thank you for the patience listening. Wait for another review, and it will be coming inshallah. Best wishes. Wama alayna illa al-balagh.